Now, you mentioned earlier the relationship, or you touched on it, between hypnosis and pharmaceuticals, and then money as well. And I'd like to talk a bit about psychiatry, psychotherapy, and some of the problems and disorders they aim to treat. So, as good physicalists, and you've already indicated this, we don't believe that depression is caused by some funk of the soul or insomnia, a curse, or something like that. We believe that things like depression, insomnia, eating disorders, PTSD, they're physical problems with the brain. And is there something about the different ways in which psychotherapeutic modalities like hypnosis versus medications treat these problems that makes one preferable over the other in any given circumstance? So you mentioned that you're a psychiatrist, you use medications as well. They're one tool you have at your disposal.
Well, I think there's a kind of intellectual confusion that's part of the problem, Robinson, and it is this: the idea that the biological is the scientific and the psychological is not. It's sort of spiritual and weird and all this stuff. But, our major advantage as creatures, the things that allowed us to evolve and to spoil the planet, have to do mostly with the 3 pounds of material on the top of our shoulders, that we can think and feel and plan, form social relationships. That's what's allowed us to survive. The human infant has the longest period of profound dependency of any creature. If there weren't a social and loving network surrounding them, we wouldn't survive. So the idea that the only scientific treatments are the biological ones is just wrong. You can do something that's very scientific, but it's psychological. You can help people to use their brains differently. I can teach people how to turn down activity in the dorsal anterior cingulate cortex, the salience network, so that they're less likely to be distracted by threat or noise or discontinuities of one kind or another. So psychosocial treatment is every bit as scientific as pharmacological treatment, but we don't think of it that way. And I'm sure that some of your listeners, even as I say that, are thinking, wait a minute, that seems different. But you know what? It isn't. You can do good science on any aspect of psychiatric and psychological treatment. And so there's this idea that that somehow the talking cures are less scientific or less realistic or less likely to help than the biological ones. And that's simply a profound misconception.
Mm-hmm. Right. And how over time has our understanding of the brain on a neurological level changed the psychotherapeutic methods we use to treat its disorders?
Well, I think when you study them properly, they provide legitimacy for the psychotherapeutic methods, so that you can show that you can turn down activity in parts of the limbic system that trigger anger or fear, for example. And you do that with cognitive behavioral therapy. There have been studies there were PET scan studies of the behavioral treatment of obsessive compulsive disorder that show effects on parts of the brain that provide cognitive reinforcement for obsessional activity and reduction in anxiety. We've shown using hypnosis that we can turn down aspects of the pain processing region in the salience network, in the insula, in the dorsal anterior cingulate, and in somatosensory cortex when you hypnotize people and teach them how to control or eliminate pain. So the science has helped us level the playing field a bit and show that there are things you can do psychologically that have what people would call real neurobiological outcomes. So, that's just a fact, but it's a fact that doesn't get much respect. And, I think we're beginning to learn from studies of meditation, which show that you turn down activity in the posterior cingulate cortex, which is the part of the default mode network where you reflect on who you are and what you are, that people who learn to meditate really get over themselves. They really see things from a non-self-focused perspective. That's what it's supposed to do, and that's what it seems to do when you look at what's happening in their brain. So, blocking serotonin reuptake is one way to treat depression, but helping people to face and reprocess the meaning of traumatic experiences psychologically and with techniques like hypnosis is also very effective. There was a paper published in the Proceedings of the National Academy of Sciences some years ago. It was a big combined psychotherapy and antidepressant medication study for depression. And the overall finding was that the combination worked better than either one alone. Well, that's, not surprising, but it fits with what I'm telling you. But they also found that people who had a history of childhood physical or sexual abuse did much better with psychotherapy than medication. And people who didn't did much better with medication than psychotherapy. So it suggests that even when you get the same overall outcome, there are certain kinds of problems that are dealt with better by psychotherapy than medication.
Is it because certain problems require, I'd say, getting at the very human root at the problem to resolve it, rather than just treating something that's wrong with the brain, some dysfunction?
Well, that's a good way to put it. I think it is true that there are some sorts of problems that don't get to the point where you're just depleted of energy and optimism, and you don't sleep well and you don't eat well, and you're just depressed. And it may be sometimes you need something to just kind of elevate your levels of energy and get you to the point where you can think through what's troubling you.